And I'm going to intro our next presenter here. We have from G Medical Innovations, it's ticker GMVD. We have the president and CEO, Yacov Geva. Yacov, are you out there? There he is. How are you this morning, sir?
Great, thanks.
We are very glad to have you. I will let you take it away. We want to hear what G Medical is about.
I'm happy to tell you what is G Medical all about.
Great. Have at it, sir.
And happy to be your guest on the show. So we'll start with G Medical, which was established in 2014 with a very clear focus on developing vital signs technologies and monitoring services. Those technologies and services are geared to reduce cost of health and increase quality of life and quality of care. All our technologies are FDA cleared and eventually patented and partially patent pending. Let's go to the next slide. Next slide. Investment highlights. I would say we are in a market which is growing and is probably going to hit around $317 billion in 2027. We are focusing on chronic health conditions where more than 6 out of 10 Americans are suffering. Market demand by doctors for services and monitoring patients, which they need to arrive quick and fast to diagnosis with their patient. We see a significant growth potential direct to consumer, as we have basically partnered with Gati-Ranker, one of the biggest, largest media marketing in the world. On a personal note, we have invested more than $12 million. Next slide. The problem rising complexity and cost. The problem rising is patient, more chronic and complex diseases due to obesity, due to many reasons, but this is the fact. Providers are short with talents and they cannot really provide the best service. Payers are pushed and pressured to cover costs for better quality of care. Government is increasing and pushed to access more quality of care. Next. Mobile remote monitoring. On the left side, you will see the patch, which is a very unique patch, and we'll talk later. In the middle, you will see the Prisma, which is a very unique product, and we'll talk about it. And on the right-hand side, you will see our monitoring call center that is providing monitoring services to the patients. The patch is providing 14 days of extended Holter, which we are paid by private carriers $300 per patient per 14 days. Our auto-detect, auto-send device, which is real-time monitoring, we are paid over $750 by insurance companies for up to 30 days monitoring of the patients. Next slide. Next slide, please. On-demand data and monitoring. The Prisma, which you see on the slide, is FDA cleared and is a diagnostic tool. It is measuring vital signs. The vitals that we are measuring is ECG, oxygen saturation, which is called SpO2, body temperature, heart rate, stress analysis. We are able via Bluetooth to receive glucose test, weight test, blood pressure test, and when I'm mentioning those tests, it is where we are talking about CHF patients, which are heart patients, COPD, which are lung patients, and others. We are running a 24/7 call centers in Austin, Texas, and Memphis, Tennessee. All our services are reimbursed, as I've mentioned, including the Prisma, which you see, which we are receiving $55 per month per patient in perpetuity. Medicare introduced this service for our product, which is a vital sign product, last year. And this is a great breakthrough because it will help us to penetrate institutions that previously was very difficult or impossible. Over the counter, as we have received not only FDA cleared, but we have received also emergency clearance for the device for over-the-counter sales. We will be selling this device for $247 a device for consumers, and we will offer 3 levels of service to those consumers. We will offer 1 level of service, which is via the cloud, for $10 a month. We will offer a second level of service, which is the full 24/7 call center, staffed by certified technicians, for $49 a month. And we will offer the third level of service with a physician for $99 a month, where we can triage a doctor anytime when the patient is requesting it. Next slide, please. Health proactive consumers. What you see here is basically the Prisma, which is, as I mentioned, FDA cleared, which is capable of providing all those measurements, and the call center that is capable of providing a 24/7 service. Down the slide, you will see Gatti Renker, who is, as I mentioned, one of the largest media marketing in the world, that will be market our Prisma via media and social media late 2021 and going into 22. Next slide. Our patent status. We are very proud with the list of patents that we hold and patent pendings for our technologies. Those patents and the patent pending will end is protecting our technologies and technologies that underway in our lab while developing. Those patents will protect those technologies as well. We are Medicare services. We are Medicare certified. Let's go to the next slide. As I mentioned, we are medical certified and we are an independent diagnostic testing facility, which in short, it's an IDTF. We have two subsidiaries, which I mentioned already, in Austin, Texas, and Memphis, Tennessee, and we are very proactive to irregular data, to deliver the data ASAP to the physicians, and if needed, taking a much aggressive approach, like ordering 911 for the patient if the patient is in a severe situation. Next slide. Here is a snapshot of our approved 150 plus healthcare insurers that are providing reimbursement to our services. So as you can see, we have Medicare, we have Medicaid, we have United and Aetna and Blue Cross and more. And it's also a snapshot of hospitals that we are in service with them, like the Cleveland Clinic, Heart Center of Arkansas, and others. Next slide. Here is competitor metrics and a growth model. On the left side, you can see the G-patch, which is measuring 6 channels of ECG versus 1 channel of ECG by the competition. This is a major difference because the heart is a 3-dimension, and so by having more channels, we can see more information. We have also received on the G-patch an emergency clearance by the FDA for QT prolongation syndrome, which is a very deadly syndrome. So we are very excited about that. And to the best of my knowledge, G Medical is the only product today that is monitoring it. The Prisma is as I mentioned already, is a unique product, and it's the only product in the market that is doing vital signs. We are looking on the markets which are the reimbursed markets, and we are looking of the millions that are the consumer market. We are looking on the millions that need the patch to be monitored, and we are looking to capitalize on the millions and tens of millions and more that needs the Prisma to be able to monitor themselves. And I can just, give you an example, not only which are the low-hanging fruit, which are the patients, and they for sure need the service, they need a product. I'm talking about the tens of millions of Americans that don't have any insurance, and they need a mean of how to get medical services. So the Prisma can be a very, very substantial bridge for those who are uninsured. Next. Management team, you will be able to read it by yourself, but we have a very experienced management team who are in the business for many years, who understands the telemedicine world, who understands where the medical space is heading, and eventually, as a result of Corona, the world understood that remote medicine, telemedicine, is the solution, because none of us wants to hit the door at an emergency room or waiting in a waiting room at a physician while you can be affected by a patient with corona. Next, board of directors. One of the best I can really say, Dr. Ken Melani, the chairman, who was the CEO of Highmark, one of the largest health insurance companies in the United States. Dr. Shuki Gleitman, who was the chief scientist of the State of Israel. Professor Rothstein, one of the really key management of two largest hospitals, and rest. Next. Our financial overview, 2018, total revenue, 3 million. 2019, 5.5. 2020, we dropped as a result of being caught in Q2, late Q1, Q2, by Corona, and all the doors of hospitals and physicians have closed to our agents, our sales reps, to enter. Not simple, but I mean, the whole industry was caught in the same situation. 21 6 months versus 26 months, we grew by over 45%. We have reduced cost, we have increased our gross profit, and still not at the place where we need to be, and we will be 39% versus minus 27%, half year 21 versus 20. We should be at the 60%, but that will take some time. Next. I want to thank you for allowing me to present G Medical in this event, and I'm open for Q&As.
Awesome. Thank you very much, Yacov. I have a couple quick questions here. So let's talk about your expansion plans for your sales force in the U.S. Can you talk specifically about any hires over 2021 that you think are really going to be helping you moving forward?
Yeah, we are planning to hire about 25 reps as opposed to very small numbers today. So this will happen this year. By the end of Q4, we will be with 5 regional managers, very qualified, very experienced, more than 20 years in the business, plus 20 to 25 reps.
Awesome. Thank you for answering that. And, at Benzinga, on Benzinga Pro, something that we look at a lot of times, I just was looking actually on our platform a minute ago, is the sell side. And I didn't see that you have any analysts covering. Is there any prospects for the sell side to be in covering G Medical anytime soon? Do you know?
Yeah. Our IPO bank is about to start covering. We are in signed agreement with another analyst group in the US. So in the very near future, we'll have more than 2 analysts that are covering the company.
Okay, great. Is that going to be in 2021 or is that going to be in 2022? Do you know?
21, probably sometimes cool. mid Q4.
Great.
And eventually 22 will be covered totally.
Okay, awesome. And then I was doing a little bit of research. One more quick question here for you, Yacov. I was doing a little bit of research and I saw that there was a company, Gunthy Renker. You recently did a partnership. Can you give any more details about the arrangement that you have with Gunthy Renker?
Gunthy Renker, as I mentioned in the presentation, is one of the largest media marketing in the world. We have signed an agreement with them to market our Prisma over the counter and to patients via RPM, and RPM is remote patient monitoring, which is reimbursed on media. It will be on television, infomercial, social media, all over the United States.
Okay, great.
We are very, very excited with them because, I mean, they have proved themselves being where they are.
Great stuff. I'm sure prospective investors out there loving hearing what you're saying here, Yacov. And we're gonna have to wrap there. Thanks a ton for joining us. This was G Medical Innovations. The ticker on NASDAQ is GMVD. Thanks so much for joining us, Yacov. You have a good rest of your day, sir.
Thank you. Thank you very much for having me.